Hey guys, welcome back to my channel. I'm going to be doing another video today, and a condition that I have is called Generalized Anxiety Disorder. Now, having regular anxiety is completely normal. Feeling anxious and worrisome is incredibly normal, but when you have a condition called Generalized Anxiety Disorder, it's a bit different. So let's get into it. I'm going to be reading off some information from the Mayo Clinic today, and I'm really hoping that you guys will engage and interact with these videos as I do them. I got diagnosed with generalized anxiety disorder in 2017 during my last inpatient stay, and it's pretty much, well, it's very eye-opening when you actually sit down and do the research, and you find out exactly like why your anxiety is so much more heightened. So let's get into it. I got a majority of my information off of the Mayo Clinic website. I also refer to the Cleveland Clinic a lot with my videos, so let's get into it. So with generalized anxiety disorder, it's normal to feel anxious. It's normal to feel especially when your life is stressful and stuff like that. However, ongoing anxiety and worry that are difficult to control and interfere with day-to-day activities may be a sign of generalized anxiety disorder. It's possible to develop generalized anxiety disorder as an adult or child. Generalized anxiety disorder has symptoms that are similar to a panic disorder, which I also have, obsessive compulsive disorder or OCD, and other types of anxiety, but they are all completely different conditions. Living with generalized anxiety disorder can be a long-term challenge. In many cases, it occurs along with other anxiety or mood disorders. For example, I suffer from bipolar disorder, in particular bipolar 1, and I also have borderline personality disorder, and like I said, generalized anxiety. I have CPTSD, which is complex post-traumatic stress disorder, and also I have a panic disorder as well. In most cases, generalized anxiety disorder improves with psychotherapy or medications. Making lifestyle changes and learning coping skills using relaxation techniques can help, but it depends on the person and how much work they're willing to put in. So here are some symptoms of generalized anxiety disorder. They can vary, but they may include the following: persistent worrying or anxiety about a number of areas that are out of proportion proportion to the impact of the events, overthinking plans and solutions to all possible worst-case outcomes. Yeah, that's me. Perceiving situations and events as threatening even when they aren't, difficulty handling uncertainty, indecisiveness and fear of making the wrong decision, inability to set aside or let go of worry, inability to relax, feeling restless and feeling keyed up or on edge. That's a huge one for me. 100%, that's a huge one for me. I am constantly on edge. I feel like I'm going to jump out of my skin like 99% of the time. Inability to relax, like I said. Difficulty concentrating or the feeling of your mind going blank. People don't talk about the physical signs, though. They really don't talk about the physical symptoms of anxiety. So you can deal with things like fatigue, trouble sleeping, muscle tension or muscle aches, trembling or feeling like really twitchy and on edge, and nervousness or being easily startled, sweating, nausea, diarrhea, irritable bowel syndrome or irritability. There may be times when your worries don't completely consume you, but you still feel anxious, and there's for like no apparent reason. Your anxiety, worry, or physical symptoms can cause significant distress in social work, or other areas of your life. Worries can shift from one concern to another and may change with time and age. The symptoms vary between what it looks like for adults and what it looks like for children. And if you have any, questions or concerns about that, we can go over that. But things that may cause intense worry or anxiety in children and teenagers, very different compared to adults. I'm 35, and my worries are completely different than, say, what my 14-year-old may be worrying about. You should definitely see a doctor. If you feel like you're worrying too much and it's interfering with your work, relationships, or other parts of your life, you feel depressed or irritable and have trouble with drinking or drugs, or you have other mental health concerns with, like, along with your anxiety, you have suicidal thoughts or behaviors, seek emergency treatment immediately if you are starting to have suicidal thoughts or suicidal, like you want to self-harm. And yeah, so if you're really like in that low where you're really starting to feel like the world will be a better place without you, seek emergency medical care. Your worries are unlikely to simply go away on their own, and they may actually get worse over time. Try to seek professional help before your anxiety becomes too severe, and it may be easier to treat early on. So basically, if you catch it early enough, the more chance of like a stability and recovery are possible. As far as the causes go, the cause of generalized anxiety disorder likely arises from a complex interaction of biological and environmental factors, which may include differences in brain chemistry and function, genetics, differences in the way threats are perceived, and development in personality. So a lot of these things kind of, for me, coincide with my borderline personality disorder. As far as like, the genetics side of it goes, there's a strong possibility that on my mother's side, my grandmother had not only bipolar disorder, but also she was diagnosed later on in life with borderline personality disorder. So those things can exacerbate the generalized anxiety. Risk factors. Women who are diagnosed with generalized anxiety disorder somewhat more often than men are. And the following factors may increase the risk of developing generalized anxiety disorder: personality, like a person whose temperament is timid or negative, or who avoids things dangerous, are more prone to getting generalized anxiety. Genetics, generalized anxiety disorder may run in families. Experiences. People with generalized anxiety disorder may have a history of significant life changes, traumatic or negative experiences during childhood, or recent traumatic or negative event. Chronic medical illnesses or other mental health disorders may increase the risk of generalized anxiety. So I have multiple mental health conditions, starting with bipolar 1. I was diagnosed with bipolar 1 a couple years ago after I had done an inpatient stay. My last inpatient stay was in 2017, where I was diagnosed with bipolar 1. I got the generalized anxiety disorder right then and there. But however, when the bipolar 1 came about and the borderline personality disorder came out, it became more and more like exacerbated after that. I've always had anxiety my entire life. So to have something like a label with it, and to know that there's actual treatment instead of just doing, therapy and, medications, like there are options for this. Having generalized anxiety disorder can be disabling. It can impair your ability to perform tasks quickly and efficiently because you have trouble concentrating. Take your time and focus on other activities. It can deplete your energy. It can 100% deplete your energy. And it can increase your risk of depression. I have struggled with depression since childhood, and the anxiety, it increases all of my depressive symptoms. And when I go into a depressed episode with the bipolar, it can make it so much harder to come out of when the anxiety is peaking. Generalized anxiety disorder can also lead to or worsen physical health conditions, such as having digestive or bowel problems like irritable bowel syndrome or ulcers, headaches and migraines, chronic pain and illness, sleep problems and insomnia, or heart health related issues. Generalized anxiety disorder often occurs along with other mental health problems, which can make a diagnosis and treatment more challenging. Some mental health disorders that commonly occur with GAD include phobias, panic disorder, post-traumatic stress, obsessive compulsive disorder, depression, suicidal thoughts, or actually committing suicide. What can you do to prevent it, guys? There's no way to predict for certain in any way, shape, or form what will cause someone to develop generalized anxiety disorder. However, there are things that you can do to reduce the intensity of the symptoms, which I'm going to be going over right now. Get help early. That's the big one. Get help early. Anxiety, unlike many other mental health conditions, can be harder to treat if you wait. Keep a journal or do what I'm doing, like keep a video blog. Track your personal life, and tracking your personal life can help you and your mental health professional identify what's causing you stress and what seems to help you feel better. Prioritize issues in your life. You can reduce anxiety by carefully managing your time and energy. That's easier said than done for, I want to say, about 98% of the population of the world. Avoid unhealthy substance use. Alcohol and drug use and even nicotine or caffeine use can cause or worsen anxiety. If you're addicted to any of these substances, quitting can make you anxious. If you can't quit on your own, see your doctor or find a treatment program that can help you. So I will fully admit to the fact that I am a smoker. I started smoking when I was an active duty military wife back in like the early to mid 2010s ish area. My ex-husband was on deployment and I was alone with our almost 1-year-old child at the time, 700 miles away from my family, doing it all on my own. And I did pick up cigarettes, and I should have known how bad the cigarettes were going to be for me. Not only because I have asthma on top of everything as far as like a physical symptom goes. However, it does increase my anxiety, and it is incredibly hard to quit. The only times that I have really quit and stuck with it were during my pregnancies. So, it's not something I'm proud of, and quitting is a lot harder than people think it is. I've tried, gum. I've tried the patch. The patches gave me nightmares on top of the other medications that I was on. We're talking really, really, really bad nightmares. And it affected my life incredibly. And because of the smoking, not only was my anxiety raised and has been raised for a while, it's exacerbated my asthma to the point where I've been hospitalized a few times overnight for a night or two because of my breathing. And I will admit I do have a lot of life stressors right now, which is why I'm using this as a platform to help me get out what I need to get out and help you guys to understand why it's so important to really speak up about your mental health and give people a strong and positive place to feel comfortable talking about it. But yes, I smoke. Not proud of it. I smoke and I vape. But I am hopefully going to be quitting very soon once a majority of my life stressors are at least not as bad as they used to be. But if anybody's got any ideas about how to quit smoking and make it effective, let me know. But stress is a key factor in something that absolutely exacerbates my anxiety. For the longest time, especially with big family events, I would say during holidays like Christmas, Thanksgiving, and stuff like that, my whole family would be upstairs and I would be downstairs in my room, and my parents would save me dinner because I could not stand to be in a small room with that amount of people. And I missed a lot of time with my family. I missed a lot of time, making memories with my grandparents before they passed. I missed a lot of time, really cultivating relationships with my brother's kids, and, reconnecting with my brother and making things better with him. So my anxiety has definitely caused a lot of issues. But on the plus side, my anxiety is curbed most of the time because I do have a service dog, which she helps, even though she's got raging anxiety too. So we're just, we're a perfect pair, her and I. But, having things that you can focus on and having things that make you feel like you're doing really great things and you've got a purpose, that helps keep my mind focused on, things that are not making me so anxious. Like, okay, so this traumatic event happened and I'm gonna like hyper focus on that and keep my mind on that instead, instead of focusing on some good things that happened. So just a few little tidbits about me and how bad my anxiety has gotten. I'm much more social now than I have been in the past, especially now that I've got my dog and, actually I've got 2 dogs. And I surround myself with animals. I surround myself with animals because it helps. They help calm me down. They help alleviate my stress. And so, having pets helps me with my anxiety. Knowing the fact that there's unconditional love that I don't have to like impress them for helps me out too. Journaling. Guys, journaling. Write down your thoughts. Do a video blog like I do. And that helps tremendously. So, but I'm going to end this video with, again, if you guys are really struggling and you need to reach out for help, please call the suicide hotline at 988 or seek your local emergency services. Wherever you are in the world, whoever sees this. Yeah. And I hope you guys have a really great day. I will be checking in and doing another video maybe later today or tomorrow. I'm going to be doing some research on another condition called bipolar schizoaffective disorder. So we will be talking about that. Stay tuned for more content, and I will see you next time.